We have discussed the use of Facet medial branch blocks and rhizotomy for treatment of your chronic pain complaints. These procedures are primarily used for neck and back pain that does not radiate down the arms, but may radiate into the shoulders or buttocks and may cause headaches. Typically 2 to 4 visits are required to complete this type of procedure. The first is a diagnostic test to determine whether the nerves innervating the structures that we're targeting are the cause of your pain. The second is a confirmatory block. Anytime we do nerve blocks, we do them twice, and we hope to see the same type of benefit with the second block as we did with the first. If both the diagnostic and confirmatory blocks are effective, then we proceed to the therapeutic or more long-lasting procedure called the rhizotomy. The rhizotomy, or burn, is where I place a needle that is insulated except for the tip on the nerve that we have determined is causing the pain. The tip of the needle is then heated up, and basically we kill that nerve so it doesn't transmit pain. These nerves innervate a very small area, and so no other side effects are typically seen with it. Nerves do regenerate, so it's not permanent, but can last 9 to 18 months. When I do the diagnostic blocks for the low back, I'll do both sides of the back. In the neck, I'll only do one side or the other. When I do the rhizotomy or burn, no matter the location, I only do one side at a time on the spine. All procedures that I perform on the spine are done under fluoroscopic guidance, which is a type of live x-ray, in the Maplewood Ambulatory Surgery Center located in this same building. Typically you'll be here for an hour to an hour and a half. If you're going to use sedation, you need to not eat or drink for 6 hours prior to the procedure, and you are required to have a driver. If you do not use IV sedation, you can drive, but I still recommend that you have a driver for the procedure. If you request to have sedation, an IV will be started before the procedure. I would remind you that sedation is only for a relief of anxiety. It does not knock you out. It is not a general anesthetic. It will mainly relax you for the procedure, and it may impair your memory a bit of the procedure. Because of that, I'm very limited in how much sedation I can use for the diagnostic and the confirmatory block. We can use a bit more sedation for the rhizotomy or burn procedure. You're taken to the operating room where we confirm your name and date of birth. You're placed on your stomach on the operating table, and a pillow is placed under your abdomen or chest depending on the location of the procedure. We clean off your back with betadine or chlorhexidine, and a sterile drape is placed on your back to keep the area sterile. I will let you know everything I'm doing throughout the procedure. I use a small needle and local anesthetic to numb the skin. This can be anywhere from 4 to 8 spots of the back, depending on the location. Once the skin is numb, I place a small needle and advance it under x-ray guidance until it's in the appropriate location. Once it's in that location, I inject a very small amount of local anesthetic, essentially a drop of local anesthetic right on that nerve. The needle is withdrawn and the next site is then done using the same technique. This takes typically less than 10 minutes to do. Once we're done, we will remove the monitors and transport you to recovery, where you will be watched for about 30 minutes. With the diagnostic and confirmatory blocks, you will typically see response while you're in recovery. These injections and the response to the injections only last for 4 to 6 hours, perhaps a day at most. It's very important at the end of this procedure that you go home and do things that would normally worsen your pain. If you go home and take a nap, we won't know whether the injection was of any benefit, and it may have to be repeated. Side effects to this procedure are typically minimal. Anytime you puncture the skin, there's risk of bleeding or infection, although this is a small needle, and that is typically not an issue. There is no steroid or medication other than local anesthetic used for any of these injections, and so the risk of allergic reaction to medication is also very small. Because there are no major nerves or blood vessels in the area of the small nerves that we're injecting, it would be very unusual to see numbness or weakness in the legs. If you have any questions regarding the procedure, please contact myself or the staff and we'll be happy to answer them.